Hello, this is Brandon from Patient Queue, and I wanted to take you through a walkthrough of the urgent care same day appointment queue or appointment schedule. It's a hybrid appointment scheduler as well as a queue, so it provides the benefit and peace of mind to patients that they can make an appointment rather than wait in a waiting room. And it also enables the practice to overbook time slots or appointments in order to sort of manage it or maximize it like a queue. In other words, enhancing access all the way around. The setting overbooking and whatnot is acceptable, works well. Most patients expect not to be seen right at the time that their appointment is. So that will work. And you don't have to overbook if you choose not to. So let me take you to the demo. And the way I set it up is the majority of folks who are going to make online appointments are actually going to use a smartphone or a mobile browser. So we put a lot of time into trying to get the scheduling side of it as well as the web widget side of it mobile ready across platforms. It's different from apps, which are made for the operating system. So we're tuning that in now, and so this particular preview here is a text campaign, which is where you can have a number on your website or in your Google account or on a banner ad that says to make an online appointment at Summit Pacific Medical Center Urgent Care. Text urgent to and provide you a number. And when the folks text, they're going to get a message similar to this back with the link. And why people like that is because it gives them directly to the page that they need to go to schedule rather than fishing around a website. Either way is fine, just a different option. So here is probably widget number 5, and I got to the point where we're not going to use the map any longer. This is as good as we can get it, and it's because of the way the map features render code. So if we take that out, what we're trying to do is get to something more along these lines. So that'll be the next iteration, and I think we'll be good to go. So I'll ask you to take a look at the information that we have here, make sure that it's appropriate. We also will change the date and time to white or some other color you can read. So how it will work is it's a same day appointment. So if you click on it, you're only going to get today's date. And when you want to make your appointment, you're going to click on it, and it will show you the range of appointments that are available. In this case, I just realized that your clinic doesn't open until 12. So we'll show everything from, well, you guys can set it up. It'll be easy enough, but at 12:30 on until your last appointment that you set. And so let me do 2 o'clock. And that will take me into the HIPAA compliant scheduling page. And here, what we're trying to define is what walk-in services are. It's important that we don't have people who are using the urgent care queue to come in with chest pain or anything like that. And down here, it just walks you through how to schedule an appointment, and all this can be changed. I mean, you could probably word it better than me. And another cool feature that we have is the ability to have or promote other sort of services or appointments that may not be standard, but things that you might offer seasonally. And for this case, I used the camp physicals. Could be flu shots, shingle shots, whatever you want to schedule. And this could even be set up to take payment separately if you're doing like a fee for service or some sort of maybe wellness program that was tied in. Or you might want to have an online wellness calendar, and folks can sign up for group classes, that sort of thing. And if you do charge, we can offer that capability. Here you'll see that this is the time zone. The only reason why this is showing up is because I'm not in your time zone. So it's sort of an intuitive feature. So for example, if I wasn't feeling well, and I'm between flights from here to Washington, I can go here and schedule an appointment when I get off the plane. So kind of neat. So here's the appointment that we chose, and we clicked continue. It's going to say urgent care, August 8th, and at 2 o'clock. If that's crossed out in red, that means that appointment was taken. And there are times when somebody's kind of slow at making an appointment, and by the time they get there, it's gone. If that's the case, they can press this button, and that will bring them into additional choices. Now here's the part we've been working on, is trying to make sure this is rendering completely in very usable form in terms of the mobile web. And I've done this a few times, so you can see my name's already in there, so that kind of helps. So 780, and I have in here, you'll receive a text message reminder before your appointment. Put in the email, and then here it says reason for your visit. You notice there's no field. That field won't be active until we have a business associate agreement, and at that point we can have it active. Very cautious when it comes to anything HIPAA related. So, but that's where they'll enter in whatever their symptoms are, and the latest research in medical queuing is any practitioner who is reviewing their patients in the queue prior to the moment they see them. It expedites the visit time by like 20%. It's pretty remarkable, and it's just the way providers think. They're always preparing, so it's definitely a process that we'll be bringing with us that's value added versus just automation. Visit someone, you'll say yes. Patient primary care doctor, no. Are you? Yes, I am. Who do you give consent to? My wife. Male. Some of this stuff I have in here just for my own program in healthcare, but may not be necessary. But advanced directives, yes. DNR status, yes. It may not be a bad thing. It's my public service announcement. Have it somewhere so at least the discussion can start happening at whatever age it is. Under 18, so this would be where the guardian fills out their information, and I'll change that from being mandatory, but right now it requires that legal guardian's contact number. In this case, I just put my own, and the guardian's address, and then if you want, we can see who has insurance. And remember, all this data that we're collecting here, we can actually use for analytics and reporting. So I always think more is better, but not to the point where it's going to deter people from using the system. Also added an ability for them to add a medalist if they want, and then complete appointment. When they complete the appointment, they're going to get this confirmation. And this is sort of filler that I have here. And it just basically is telling them what they should bring when they do show up. That's important. And then they can add it to their appointments, which is, which I think is a substantial benefit to, sorry, got a new phone, substantial benefit to the whole program, because it really does get it on their calendar. And they'll get a text message, and they'll also get a email confirmation, and that's pretty much it. And I'll send you another web demo on how to set up the scheduler and what it looks like from the provider's point of view. I just wanted you to get a visual of the patient experience. Thanks.